Honorable Member for Nipa-Kutubu.
Thank you, Deputy Speaker. Lord, give me time. Me like taking this time, Lord, talk thank you, Lord Minister of Health, also on the Doctor House. Me like talk thank you, Long Prime Minister, Lord, this time give this ministry, Lord, one the doctor. Me got strong plan, a big of faith that Minister of Health, now I sit down and me the right person. We said by addressing plenty all health issues to make out the country below me. Thank you, long aste. Me play stop long government function room na plan your presentation by the Port Moresby General Hospital staff only can make him. Me like talking house na country. Also Port Moresby General Hospital let me level 7 specialist na teaching hospital below me. Time me been established school or this time maybe taking about 15 years or so go finish. Now me can talking you me also this house get me transform over the last 13 to 14 years now. Me talk thank you long. All government also put in investment going to this facility. Now also private investments also Kumul Petroleum Holdings want administration long and he put in plenty money go inside. Long display housing, now you make got interventional cardiology and stuff, where you got heart attack or you got some blood blockage, long artery blood heart blood you can go, or even if you know got some blood blockage, you can go check him. And all can tell him you whether or not you got blockage artery blood and they can intervene, now straighten you. This like an intervention and you know been stuff before. And plan the old PNG citizens who go to Philippines, now go to Singapore, Australia, can help. Like you may say wasting plenty money. Now plenty man merisa die so me looks have along this public private partnership only make him lahap. I'm so cancer facility too only building stuff and only work long looking sample intervention long kidney too. So level Port Moresby General Hospital and come up the desired level 7 facility that you may like him. So thank you, long all management, long Port Moresby General Hospital, and the board, na Kumul Petroleum Holdings, and of course the government for standing behind this hospital. One play issue, long health, long country, play me looking staffing issue. We may got the School of Medicine and Health Sciences and staff, but I'm at long University of Papua New Guinea. That is why every year I'm also producing maybe 45 to 50 graduates. Now that is not enough for our expanding population. You may got population growth about 2 to 3%. Every year you may got 200 to 300,000 people we're adding to the country, but the number of doctors we are producing every year is not enough. Not enough. And we need to look at seriously addressing this issue. You know, what you may caramal doctors outside they come inside. I also want to mention there's about 46 or so doctors. You may have opinions only go contest the election. But because the law, you may pass him, only had to go back to the system and only stop. You know, these are critical workers. So what do? We have critical shortage of workers, health workers, especially in this country. And if it means for us to have a standalone university for this country, medical university, we need to consider doing that. I'm sure there's a proposal somewhere there. But I hear that UPNG, Karam, I think NEC, or School of Medicine, Health Sciences, go to court or something like that. So we need to clear this path so that we can have enough health workers for this country, for a growing population. The other issue, the provincial health authorities. Some provincial health authorities are working, others are not working. It depends on the people that are in the chair. And the issue with the way only setting up the Provincial Health Authority Act, the provincial hospital CEOs only come up CEO block PHAs, and they report to a board. And the board then reports to the health minister. Now, I don't see how the health secretary comes in, maybe operationally or functionally, how only report to the health minister, and there's a missing link there. So this house, this time, with the leadership of the health minister, we need to pass the PHA regulations. I think there's a missing link. We don't know what the PHS are doing. They are not regulated properly. There is no direct intervention from the health NDOH because the PHA CEO doesn't report directly to the health secretary. They report to a board, and the board reports to the health minister. So we need to start looking at the regulation as to how we look at the way the PHA is set up. The next issue may like total long and long procurement and supply chain system law, especially health sector law country below me. I also want to remind the House and the country that we have heard about this wastage or so of medical supplies that have been sitting around for about 6 months because of the contracting issues, one time all supply chain companies. We need to look at this 100% medical kit. This is a 100% medical kit, yeah. It consumes about 25% of the entire NDOH budget every year. And that's a lot of money. And currently we use what we call the push system. In the push system, there's a certain amount of package that the contracted company is supposed to supply to the health centers and the aid post. And they do that maybe 3 or 4 times every year. And it is supposed to estimate to supply about or save about 5,000 persons. What I see on the ground in the health centers and the aid posts is that there is a lot of wastage. Most of the medical supplies that are being sent are not being utilized properly because most of the time the people don't need it or they don't know how to use it. But we keep pushing it down, and you go to the health centers and aid posts, let me ask you, blogger leaders, go and check them all. They will have so many of this stuff expiring and sitting there. And who's paying for it? We are using public funds to pay for it, and the only way I see, the only person benefiting out of this system are the persons who are supplying it. There people are paying for unnecessary goods that are being pushed down the system, and the supplier is laughing and going to the bank while we having issue in the aid posts and health centers. They are trying to find out how to discard these things because they don't know how to use it. Or they don't need it too. So we need to go back and look at what are the real contents of this 100% health kits. And do we really need it at this time? It started since 2014. Now I'm on 2022. That's about 8 years, and we've been doing these things without a review. Our review is mandated at this time so that we buy what we need. So we need to go back to the, instead of the push system we are using, we should go back to using the pull system. So the health centers and aid posts order what they need and we supply. There are issues like total long boards. You go to America, they have the Food and Drug Administration, FDA. You go to Australia, they have what they call the TGA, the Therapeutic Goods Administration. In this country, we have a lot of junks, medical supplies coming to this country without being checked. Whose job is that? The health boards. We have the National Health Board, we have the Pharmaceutical Board, we have the Medical Board. Also, there are a lot of medical workers from outside coming to this country, and nobody is checking them properly. I can tell you the way we are trained in this country is much better than how some countries train the doctors. Some of those doctors, especially coming from the Asian side, from residency, they go direct to, from medical school, they go direct to specializing in a certain field. If you want to do surgery from medical school, they go straight to doing residency in surgery only. And they don't know about other things. And yet we bring them here, put them in emergency, and we expect them to attend to pediatrics or all other honorable medical diseases, and they don't know. So we need to look at this, the way we are allowing foreign workers to come. We need to provide proper scrutiny. We need to look at the goods, the medical goods. Recently, we've had this issue about, in PMGH, the propofol issue. You know, critical medications being brought into this country without being properly checked. You know, there are some medications that are coming to this country, like, for example, Augmentin. We say it's 125 or 165 on 125. That's what it says on paper. But nobody checks if what is inside is what actually they say it's on the package. Who does that? So we need to look at, and the PHA and the boards, they need funding. You know, if you look at the medical board, you go to the second floor of Aon House or the office they're in, it's a very small, stuffy room. We need to fund them properly so that they can operate. Right now, I don't know how much funding it is and whose responsibility it is, so we need to look at that as well. I think the second last one is on the health services in the district and rural health. If you look at some countries, like Fiji, even in Australia, in the hinterlands of Australia, the national government does not have the capacity to go and deliver quality health services to the remote and rural areas. That's where most of our people live in this country. And I support one of my honorable members. He talked about the partnership with the church health services. I think that that's the way we should go, especially in the remote and rural areas of this country. We need to partner with private medical service providers. Public-private partnership is the way to go in the district, the remote areas that we come from. I put that on the floor. And finally, pre-hospital care. Pre-hospital care talks about before a patient is brought to the hospital, what happens? Who looks after them? If you have a heart attack, you have only 3 minutes to do something. 3 minutes, and if you don't do anything in 3 minutes, you are dead. So right now, we don't have any pre-hospital care system. The only we have is provided by St. John's Ambulance. In the remote parts of our country, people are dying. These deaths are preventable, and they can be saved. I ask this House to consider setting up a national ambulance service. National ambulance service so that we can have ambulance staffed with people who actually know how to do the job, who can go to where the patients are, treat them, stabilize them, and bring them to the hospital. We don't have them in our districts. Even many of our provinces don't have it. Thank you very, very much for giving me the time. I'll stop here.